Hey everyone, Dr. Shook here. I hope you're doing well today. In today's video, what I want to talk to you about is Alzheimer's disease. And in particular, I want to talk to you about one of the subtypes of Alzheimer's that have been recently identified. Now, there are currently 6 subtypes of Alzheimer's that have been identified. Type 1 is inflammatory Alzheimer's. Now, if you've never heard this before, then you're going to learn a lot. I'm only going to go through this one subtype. I will have other videos and live streams where I'll talk about these, but this is really important. This is probably one of the most common subtypes of Alzheimer's. Whenever we do testing with people, we see that this is very, very common, and it's a huge issue that's being missed. So let's talk about this. Inflammatory subtype is basically, it is caused by anything that drives inflammation within the body. Okay. Now, this contributes to the changes that we see with Alzheimer's because what it does is inflammation affects this amyloid precursor protein, right? So when we talk about Alzheimer's, we often hear the word beta-amyloid plaques, right? We hear that said because that's what is often seen on imaging. It's these plaques that form in the brain. And there's a molecular switch on the neurons, on the nerve cells, that can be flipped one of a few ways. Inflammation flips that switch in a way that promotes the changes, the negative changes seen in the brain with Alzheimer's and cognitive decline. It promotes the beta-amyloid plaque formation. So if we can understand this switch, the things that trip that switch in a bad way and promote Alzheimer's, or if we can look at this and figure out the things that trip that switch in a positive way that keep the brain healthy, then that can give us control so that we can intervene with dietary and lifestyle interventions to help halt, slow, or reverse the changes seen with Alzheimer's. Does that make sense? So we know that inflammation is one of the things that trips this protein in a very negative way. So what are the common drivers of inflammation? Well, the things that we commonly see that are driving an inflammatory process are food protein reactivity. Now, we're not talking about food allergies. We're talking about something called food sensitivities, which looks at a portion of the immune system called the IgG system, okay, immunoglobulin G. This is not a food allergy, which is an IgE reaction. If you check IgE, you're looking at the wrong part of the immune system. So food protein reactivity, cooked and raw versions of the food can trigger an immune response and drive an inflammatory process. We want to know if you're reacting to any of the foods that you're eating. If you are, we want to take them out of the diet temporarily and keep things in that you're not reacting to while we're addressing the factors that are likely promoting this, like poor gut health, poor enzyme release, poor stomach acidity, a lot of those factors. We want to ask questions about why that might be happening. We want to look at the whole person, okay? We want to look at the whole person. But we want to understand, we're just talking in isolation about some of the inflammatory drivers. Pathogens, this is huge. This is absolutely huge. In the brains of people that have passed with Alzheimer's, that donated their bodies to science, on autopsy, they've identified viral pathogens in the brains of people with Alzheimer's. They've identified bacterial pathogens like Lyme disease, like the Lyme spirochete, a bacteria that is shaped like a corkscrew in the brains of people with Alzheimer's. And they found that those beta-amyloid plaques are very antiviral and antibacterial. So we think that the brain is making these plaques to protect it from pathogens or from things that are in there that shouldn't be there. So we look at viruses like herpes simplex virus, like the cold sores. That's what they found that in the brain, HSV1, herpes simplex virus 1, bacteria, fungal infections drive inflammation, parasitic infections drive inflammation. These are all big issues. We can test for these. If they're there, we can remove them. Makes sense, right? Remove them, lower the inflammatory process. Chemical reactivity. So metals and chemicals in our environment can trigger the immune system. If you have reactivity to these chemicals or metals, we want to look at the factors that promote that. We want to see if you do have this type of reactivity, can we remove those chemicals and those metals to help your immune system calm down? And then poor antioxidant status, poor fatty acid status also contribute quite a bit. So we can take this approach and it can give us very good strategies to help you. What we do is we take a process of detect, remove, and repair. And if we use this approach, we can take an approach that really helps you to get to the root driver of the process and improve your brain health. I'm Dr. Shook. If you have any questions or need anything, please don't hesitate to reach out to us and let us know. You can go to new.alz